Whenever you're good. Okay, perfect. Alrighty, well, welcome everyone. I hope you all have been enjoying the Health and Wellness Lab Exercise Oncology Education Week. My name is Emma McLaughlin, and I am a master's student in the Health and Wellness Lab, and I'm working with Doctors Nicole Koulos-Reed and Amanda Wurz, who are both leaders in the field of pediatric exercise oncology. And today I will be talking to you about pediatric exercise oncology, guidelines, recommendations, and next steps. Before I dive into the content, I first want you to know what you can expect from this presentation today. And when you get up from your computer from yet another meeting and education session this week, I hope you'll leave with an understanding of the benefits of physical activity for children and adolescents affected by cancer. You'll learn about the International Pediatric Oncology Exercise Guidelines, or IPOEG statements. And you'll also leave with an understanding of the scope of implementation of physical activity and supportive resources for this cohort. So to get started, pediatric cancer refers to cancer that is diagnosed in a child or adolescent, typically before the age of 19 years. This group is a small and distinct population because a diagnosis of cancer in this age range is quite rare, and cancers differ from their older counterparts. As well, children and adolescents are part of complex family systems and only just learning how to engage with the world and those around them. And because of this, in many cases, they experience negative effects in physical, so things such as increased pain or decreased strength or decreased range of motion. In psychological areas, so things such as reduced quality of life or impacted self-esteem. In social elements as well, so things such as experiencing isolation, as well as cognitive effects. So this includes things like difficulty with impulse control. Because of this, researchers like us have concerned themselves with identifying interventions or strategies to help counteract this burden while also improving well-being. And one main strategy that has been found to address or improve many of these negative effects of cancer and its treatments is physical activity. And we and others have found that physical activity can positively impact outcomes across physical, psychological, social, and cognitive domains of functioning. And evidence is reported in descriptive and experimental research studies and has also been summarized in systematic reviews. So descriptive studies are those that do not include an intervention. So there are studies that look at the relationship between those who do more or less physical activity and how that impacts the outcomes of study. And this type of evidence suggests that taking part in physical activity is related to increased quality of life, physical fitness, cardiopulmonary functioning, and cardiovascular profiles, and can also help to decrease psychological morbidity, cognitive impairment, risk of cardiovascular events, and all-cause mortality. Experimental studies are another type of research that involves intervention. So this is where people get access to or do not get access to a physical activity program and or other supportive resources. Physical activity interventions have also been found to be safe and feasible. And in a recent review that we conducted, only one study reported an adverse event where a participant sustained an injury, they received immediate medical attention, and they were able to recover and rejoin the intervention. Specifically, physical activity interventions or participation has been shown to increase physical activity levels while decreasing sedentary time, so decreasing sitting time, as well as improve physical, psychological, and social outcomes. In terms of review evidence, a review is an important type of evidence that helps to summarize a number of different descriptive or experimental studies. So it identifies and summarizes a body of literature on a specific available topic. And there are several reviews that are published in our field of pediatric exercise oncology. And in fact, we recently completed a comprehensive systematic review and found similar to what I already said. And that's that physical activity is safe and feasible for children and adolescents affected by cancer. More specifically, in this review, we examined 5 main outcomes, and the outcomes we explored are on the screen here. So we have physical activity behavior, physical, psychosocial, cognitive, and other outcomes. And these other outcomes included things like dietary or energy intake, as well as the length of hospitalization. And in general, there were improvements or no changes in all of these categories. which suggests to us that physical activity participation can offer a number of benefits. For example, when we look to children and adolescents on treatment, we see that physical activity can lessen symptoms and side effects. It can also help to promote bone mineral density and muscle strength, and positively impact immune function. In this way, we would not expect to see improvements in outcomes during treatment, but rather we'd expect to see a mitigation of decline. Conversely, after treatment, physical activity may improve cognitive functioning, alleviate symptoms of cardiac toxicity, improve bone mineral density, promote fitness, and decrease the risk of metabolic syndromes. So after treatment is when we might expect to see a greater improvement due to physical activity. And because of this, and because of the benefits, developing guidelines is important so that we can help children and adolescents affected by cancer experience these benefits. And some efforts have been made to implement this evidence into sustainable programs and resources. First, we have locally in Calgary, the Pediatric Cancer Survivors Engaging in Exercise for Recovery, or the PEER program. And I know we have Dr. Carolina Chmarovina on the call today. And PEER is a volunteer physical activity-based program for different age children within the community. And it is offered to children and adolescents affected by cancer, along with their siblings. And results from a 2017 study assessing this community-based PEER exercise program reported that it was safe, feasible, and sustainable. Additionally, in terms of existing resources to help support movement in this population, two good examples of this are the Guide for Keeping Active During Cancer Treatment, so on the bottom of my screen here, which was prepared by a group in Australia, as well as the Pediatric Oncology Exercise Manual, or POEM, which was prepared by a team of international experts and led by researchers here in the Health and Wellness Lab. And so both of these documents are a great starting place to help individuals learn more about exercise and to help support individuals, specifically children and adolescents affected by cancer. And so although these programs and resources are a great start, until recently, a big barrier to physical activity in this population was the lack of physical activity guidelines, or more specifically, information describing how to do physical activity and how much. So to help address this, we decided to create the International Pediatric Oncology Exercise Guidelines, which I'll now refer to as the IPOEG moving forward. So over the next few slides, I'm going to walk you through the process that we took to create the IPOEG, which are guideline and recommendation statements around physical activity for children and adolescents affected by cancer. Our preparation phase took place from September 2018 to September of 2019, and we started with a core team of 9 international experts from 6 countries. From here, we identified over 120 international experts from 22 countries working in the field of pediatric exercise oncology. So some of these individuals identified as researchers, healthcare providers, allied healthcare providers, and exercise professionals, just to name a few of the designations. And although this slide looks busy, it's really to show you the spread of the individuals who helped us to develop the IPOEG. Next, we gathered data from our network of over 120 international experts from 22 countries from February of 2019 to August 2019. Data gathering included 3 online surveys, and the surveys were designed to ask broad questions initially and then get more specific over time to help us come to consensus, so to agreement with our large team. And we came to consensus on our definitions, content, and the types of evidence for the IPOEG. At the same time, we also conducted the literature synthesis, which I mentioned earlier, where we identified 20 reviews and 69 experimental articles to help us understand the benefits and the state of evidence. In September of 2019, we had an expert meeting with our core team of 9 international experts. We also included 2 local healthcare providers and 8 trainees, not all of whom are shown in this picture here. And at this meeting, we summarized and presented the findings from the 3 surveys, as well as the literature synthesis. And we worked as teams in an iterative fashion to come to agreement on the IPOEG content. And we got to do this in the beautiful sunny Banff, inspired with the mountains behind us. But what we took from this meeting was that we drafted the guideline and recommendation statements, which we then returned to the larger group of international experts through another online survey. So from October 2019 to February of 2020, we collected this data and finalized the IPOE guideline and recommendation statements. Now, I know you're probably very curious, Emma, what does the IPOE say about physical activity and how much this population should be doing? Now, before we do get into the IPOE, I do want to say that we will be releasing these statements very soon through a publication, so please do not share these guidelines at this point in time. But before we do dive into them, there are two important definitions that I want to go through, which are movement and exercise. And if you've been, I know a few of you have been to some of our other sessions this week, you're likely very familiar with these definitions. But going through them, movement is defined as bodily motion that requires energy expenditure. And movement might look like us sitting right here, doing some shoulder rolls, relaxing from our long week. Maybe you're giving yourself wiggle of the fingers, of the toes, some nice deep breaths as you're moving through here. And so movement can include our activities of daily living. It's anything that you do to move your body. Whereas exercise is defined as planned, structured, and repetitive physical activity for the purpose of conditioning any part of the body, improving health, and to maintain fitness. So moving into the IPOE guideline statements, we developed the guideline statements to advise people on how to engage in physical activity. So this means how often or how much. And these statements are included here on the slide and include choose to move, do what you can, do it when you can. Movement is possible and important for every child and adolescent affected with cancer across all ages, abilities, diagnoses, stages, and phases, and across all settings. So including places like the hospital, within the community, at school, and at daycare. And movement might look and feel different day to day, and that is okay. So as you can see, these guideline statements are quite general, and this is because of the state of our evidence right now. We don't have enough data to specify the times per week or the intensity, but we do know that movement in general is good. So the key takeaway is the importance of increasing movement and supporting children and adolescents to move in a way that feels good for them. We also have some content on how to advise individuals on the transition from movement to exercise. And I'll now give you some time to read this slide here. And as you can see highlighted in red, when transitioning from movement to exercise, or in the cases where you were unsure about the safety of movement, it's important that we are referring children and adolescents affected by cancer to their healthcare team or to the recommendation statements. And so we created recommendation statements to advise individuals on how to tailor physical activity based on specific needs or circumstances. And so here we can see that communication with healthcare teams and qualified exercise professionals are important to promote physical activity. And beyond this, an exercise professional with specific pediatric cancer and exercise knowledge gained through training and/or clinical experience is important to ensure safety and effectiveness of exercise for children and adolescents affected by cancer. So the goal of this information is to clearly describe who is an exercise professional and to underscore the importance of ongoing and clear communication. Further, the importance of communication is emphasized in the following recommendation statement, where exercise professional may be necessary to support children and adolescents affected by cancer with initial goals. And this would be up to the discretion of and in communication with the healthcare team, as well as the family. To help facilitate this communication and professional expertise, we created an intake to move more form, which includes the items listed here. So this includes age, the date and the diagnosis, treatments planned, current or previous, other medical issues or concerns, current symptoms that could impact movement or exercise, physical restrictions, other therapies, current or previous, physician notes, the participants' preferences and barriers, and their current movement, exercise, and physical condition. And so, although all of these points are important, as a behavior change researcher, I want to place emphasis on the last 2 points. Because understanding a participant's preferences and barriers to physical activity, as well as their current physical activity levels, is critical to tailoring to promote enjoyment of physical activity as well as effectiveness. So the IPOEG represents an important first step to support greater physical activity in this population. And subsequent steps now include efforts to ensure that these guidelines and recommendation statements get into the hands of end users or people who will benefit from the knowledge and use of the IPOEG. And that's where my master's project comes in. So the specific objectives of my project are to, 1, identify the types of resources that are needed by end users. So resources are things such as posters, brochures, videos, etc. The second objective is to co-create resource content with end users and a design specialist. So this resource content is the specific information that is included within these resources. So specific information related to the IPOEG. And the third objective is to develop dissemination plans to distribute the finalized IPOEG toolkits with end user groups to facilitate outreach. So these dissemination plans are strategies that can help us to get these resources into the hands of other end users who might not have access to our manuscript or might not have time to read our manuscript. To do this, I am working with 5 different end user groups. So we have children and adolescents affected by cancer, caregivers, healthcare providers, qualified exercise professionals, and community-based organizations. And we're working in an iterative nature along with a design specialist to help create these resources and the content to create the IPOEG toolkits. Beyond the IPOEG toolkit, we recently developed a physical activity program for children and adolescents affected by cancer, or IMPACT. And Dr. Wers covered this in her talk earlier this week, which was pre-recorded, which was addressing the needs of adolescents and young adults affected by cancer through physical activity. But briefly, after speaking with international experts, healthcare providers, patients, and caregivers, we have developed this IMPACT program, which consists of an online one-on-one physical activity program with 2 to 3 sessions per week, ranging from 15 to 45 minutes in length for a total of 8 to 12 weeks. And Dr. Wers goes into more detail in her presentation as well. So as you can see, there is a lot of work and a lot of ongoing work to ensure that children and adolescents affected by cancer have opportunities to access physical activity. In wrapping up, there are 4 take-home messages that I hope to leave with you. The first is that physical activity is safe and beneficial for children and adolescents affected by cancer. And we saw this for both on and off treatment. Second, although efforts have been made to promote movement in this population, large gaps remain. The third is that the IPOEG statements were drafted to help address these gaps. And the IPOEG statements emphasize the importance of moving more. And movement can look just like what we did, those shoulder rolls, wiggling the fingers and the toes. And finally, next steps include efforts to translate evidence to practice through resource and program development. In conclusion, I would like to take the time to acknowledge the Health and Wellness Lab where we are doing our research. And I would also like to thank Drs. Kulos Reed and Amanda Wers for their support and development of the IPOEG and leading in the field of pediatric exercise oncology. I would also like to extend gratitude to the graduate and undergraduate students who have been involved in these ongoing projects, as well as a huge thank you to our funders who have made all of this work possible. And I want to thank all of you for your time and attention this afternoon. Happy to connect with you through my personal email as well as our lab email as well. And we will stop the recording and stop the share screen. I'm happy to answer any questions you may have at this time.